Today we're going to look at one of the costliest problems in medical practices, no-shows. Patients who book appointments and then don't arrive for them waste not only the doctor's time, but other human resources as well. And it's not just problematic for small practices. According to the Medical Group Management Association, no-shows may account for as much as half of all appointments in high-volume practices. To demonstrate how costly they can be, let's assume an average no-show rate of 2 per day with the average loss of $100 per patient. At a loss of $200 per day, a practice can lose a whopping $50,000 per year. The loss can be even greater if office procedures are also canceled with no-shows. With this kind of financial drain, we should investigate causes of no-shows to your practice and solutions to reduce them. First, I suggest you start by reviewing the charts or schedule and identifying patients who fail to keep appointments. Then have someone in the office contact each patient and ask why. I suggest your office track the number of no-shows on a quarterly basis. Then you can start comparing past experience with new steps that you can take to reduce no-shows. You may find after calling patients that most no-shows are new patients who schedule appointment weeks or months in advance. If so, then you should look for ways to shorten the wait time. I recommend making it your goal to see a new patient within 3 days of the request for the appointment. One way to accomplish this is to make use of what I call sacred time. That is, you allot sacred time as an open, unscheduled period at mid-morning or mid-afternoon every day. These open slots can be used for new patients, urgencies, or emergencies. Of course, you must see medical emergencies the same day, so by setting aside sacred time, you won't have problems with disrupting the schedule. If you find that some no-shows are repeat offenders, then provide each of those patients with the last appointment in your clinical day. This way, a no-show will not impact your schedule if they don't show up in the middle of your clinic day. If necessary, send them a written note which describes their impact on your schedule and that the patient must make greater effort to keep the appointment. Now, no-shows raise an important question. Should you charge the patient who does not keep an appointment? You will find these charges are very difficult to collect. In order to collect, it is necessary to have the patient sign an agreement informing of the charge for failure to contact the office 24 hours before canceling the appointment. I also would like to point out that charging a patient for missing an appointment creates ill will among patients and may also negatively impact referring doctors. This is not a habit I recommend. Bottom line, preventing no-shows is a proactive process. First, make certain that you allot a reasonable time period for new patients. Next, identify obstacles for patients keeping their appointments and carefully monitor the number of no-shows occurring in the practice each quarter. Finally, my advice to doctors, be on time.